Bismillah ar-Rahman ar-Rahim. We will talk about von-Willebrand disease. It is the most common hereditary bleeding disorder. The incidence, it may be as high as 1 to 2% of the population, where the males equal to females in incidence. Function of von-Willebrand factor. First, carrier protein for factor VIII. Second, causes platelet adhesion to the damaged epithelium. Severe deficiency of von-Willebrand factor may lead to secondary deficiency of factor VIII. Clinical presentations. The bleeding is mild in most cases and restricted to the mucocutaneous bleeding, easy bruising, epistaxis, menorrhagia, post-surgical and post-traumatic bleeding. Homozygous von-Willebrand disease, that is type 3, may lead to severe bleeding which may be clinically similar but milder than hemophilia. Types of von-Willebrand disease. There are several variants of von-Willebrand disease. The most common variants are type 1, the most common type, representing about 85% of cases. It is caused by the quantitative decrease of von-Willebrand factor. It is inherited as autosomal dominant inheritance. Second, type 2, where there is 4 variants, A, B, M, and N. It is rare, more severe, and less responsive to treatment than type 1. It is caused by the qualitatively abnormal von-Willebrand factor. It is inherited as autosomal recessive inheritance. Third, type 3, it is also rare, more severe, and less responsive to treatment than type 1. It is caused by the absence of von-Willebrand factor. It is inherited as autosomal recessive inheritance. And the last one is platelet type, or what we call pseudo von-Willebrand disease associated with thrombocytopenia. The diagnosis of von-Willebrand disease by: first, prolonged bleeding time; second, prolonged partial thromboplastin time. But we should note that both PTT and BT may be normal in type 1 von-Willebrand disease. Third, von-Willebrand factor assay. Decrease von-Willebrand factor antigen representing quantity, or decrease von-Willebrand factor activity. And fourth, there may be decreased factor VIII or thrombocytopenia. Complications of von-Willebrand disease are rare. In adolescents, female blood loss due to menorrhagia can lead to severe anemia, either acutely with signs and symptoms of hypovolemia or chronically caused by iron deficiency. Individuals with type 3 von-Willebrand disease can manifest joint or muscle bleeding similar to individuals with hemophilia. Treatment of von-Willebrand disease. First, desmopressin DDAVP for type 1 and some of type 2. A dose of 0.3 microgram per kg IV will increase the level of von-Willebrand factor and factor VIII by 3 to 5 folds. Intranasal DDAVP, what we call stimate, is particularly helpful for the outpatient treatment of bleeding episodes. The dose is 150 microgram, representing 1 puff for children weighing less than 50 kilogram, and 300 microgram, that is 2 puffs for those weighing more than 50 kilograms. And the second modality of treatment is replacement therapy, that is von-Willebrand factor concentrate for all types. شكرا جزيلا لإصغائكم.